Okay, November 8th, PHPA. We're having Anna today. So let's continue. Zoom reminders. Use your first and last name for attendance purposes. Always keep yourself muted. If you have a question, type into the chat. We do go over them towards the end of the meeting. How to sign up for Remind. Text 8110, the message at SMC PHPAA to receive a text for reminders for meetings and events. You can also visit our website too.
Hi everyone, don't forget to scan our barcode over there or the QR code to get access to our link tree where we have our links for Discord, the website, Instagram, Facebook. Feel free to follow us on like Instagram and Facebook to get like weekly reminders on the meetings, and then our Discord for any questions, and our website too. You can just sign up to become a member. And next week is our final meeting, everybody. So we have our last speaker, Mary Dinsdale. She's actually my boss. So she'll be coming in and talking about, well, she's a registered dietitian. So you have any questions regarding dietetics, or we mainly are going to be concerned about just gathering everyone's opinion from every healthcare field and seeing how that works with dietitians. So if you're planning on becoming, like, let's say, a respiratory therapist, how can someone in that field and a dietitian help someone who has like dysphagia, similar things like that. If you're interested, feel free to come join us. We will be dropping a Q&A in the chat to see what kind of questions you may have.
Hi everyone, welcome to our Student Spotlight. If you have an experience or achievement that you are proud of, look for the PHPA Student Spotlight form coming to your email and tell us the details of your achievement, experience, or goals. And Spotlight students will be notified when chosen and announced on our weekly Instagram, email, and website.
Hi everyone, for today's meeting, we have our honorary guest speaker, who's Anna. She is an MD. She just graduated from medical school in Mexico City. She's specializing in neuroscience and surgery. And without further ado, I would like to let her have her spotlight.
Hi everyone. Thanks for inviting me, Alexa. Thanks for the introduction. I'm not specializing yet, but I did some research internship in endovascular neurology. But I would like to share my screen to begin talking about a little bit of how my medical journey was these last years. I would like to say that every journey and every person has their own unique career path, and everyone shapes it with their own interests and passions. So I will be talking about my experience and how I managed these last years, but everyone is different and will be discovering along the way which are their own interests. So I would like to talk a little bit of why I chose medicine and explain a little bit of how medical school worked for me in Mexico City and my daily routine, so you can have an idea of how every day is in the hospital and in the university. Also, some general recommendations of things I would have liked someone to tell me before I started with this journey, and some different career paths within medicine that you can choose. So you see that it is a very broad career. So there are many options you can choose from once you finish medical school. So why I chose medicine in the first place? Well, since I was a little girl, I was always interested in science, and I was really curious on how things work, how the body works. I used to hear difficult words like what is mitochondria, what is a cell, and what is the brain and stuff like that. And I was drawn by those things. So I always knew something that had to be with science. And I think the most important thing is developing this curiosity. Then the second thing I noticed in myself was, and something that is really common in students that want to be in the medical field, is trying to be of service and contribute to the society. So that was a real big factor on choosing my career. And the third one is something that could be global. And I thought about this like, I am in Mexico and my body works the same as a person's body in China or in Indonesia. So I wanted something that could be applied in any part of the world. Every country has their own public health policies and different like policies, guidelines, and different treatments, but it is the same, like physiology is the same any part of the world. So I really like that. And whenever you think of choosing your career path, I would say the most important is finding your passion and making it compatible with your own abilities. So that will be really the most important thing that I will say to you tonight, that find your passion and try to combine it with your abilities. So I divided my medical studies in three. I would like to talk about each one of them, and as I said, how the daily life for me. And if you have any questions, as you said, you can type it in the chat and I can address them right now or at the end. So the first thing was medical school, which was the first 2 years only classes in university, and the second 2 years was classes in university, but also going to hospitals in the morning. So the first years were basically different classes about cell biology and biochemistry, anatomy, physiology. So these were really hard at first because you have you have the idea that you will be starting to study medicine and then you will immediately know what is going on with the body and you can give medicine to people. So the first years can be really hard and maybe you would feel like you're not learning that much about medicine. So you may have to keep this in your mind, that the first years will seem that are going slow, but really at the end you will see that it's important to have these bases. And I would say that asking questions is really important in these first years, but also finding your own way on how to study and how you like and how you learn. But you can use different tools that you can find on internet. For medicine, I would suggest Osmosis, Ambos. YouTube has many videos of people explaining and willing to make it in simple terms. So it's really helpful to find these different tools. Also books, but there are like specific books like crash course and things that are simplified. So don't try to just go into very complicated books that will only make you feel more confused in the beginning. And also finding other friends that want to study with you, so you can adapt this to how you can work on your own and with other people. Also, I would suggest something really important: building friendships with people that study with you, because this way you can build like a network of support. And this was really important during my studies. And also seeking communities and joining groups like this one. I think it's really important to find people that are like-minded and will help you overcome some challenges if you do it together. Also, trying to define a specific interest, although this can be a little difficult in the beginning, it will help you to shape, even if it's not since the beginning, but it really will help you in the future if you know a little bit of what is your inclination inside of medicine. But balancing study life and personal life was really, really important in all of my first years, because you burnout is real and you need to prepare yourself physically and mentally. It's not difficult. I think that around medicine there is this it's really common to think that it's impossible or really difficult, but it's just about balancing your life. You need to prioritize being with your family and with your friends and doing things outside of medicine. So a day-to-day in university was basically waking up, going to your classes, and I would go back to my house and maybe do some homework, or if I didn't understand something during a class, I would look for a video or maybe read something about it. I am a very visual person, so I like videos with images and drawings and people explaining things, maybe in a funny way. So that really helped me these first 2 years. Then during the next 2 years, we have clinical rotations. So my day would look a little bit like waking up in the morning. I would arrive to the hospital at 7 a.m. and we would be with a doctor the whole day. We followed him in the hospital to see patients. He would explain things. We would do physical evaluations of the patients. Sometimes we went to classes in the hospital, because there are hospitals where there's other doctors doing their residency, so they have meetings and they can explain things to you. So every day was different, but generally we would go to the hospital 7 a.m. and then go out at 1 p.m. And then all the afternoon we would have classes in the university to kind of reinforce what we saw at the hospital. And I would say that here the most important recommendations I would give is showing interest when you are with doctors, and finding, if you have the luck to find a doctor that you feel comfortable with, then I would suggest to find a mentor. It's really, I couldn't emphasize more on finding someone that is more experienced and that could guide you and introduce you to what they do every day and how like general recommendations, and maybe he can suggest any congress that will be going on in the next weeks or months, or any type of mentorship that you can get from people that are more experienced, I would say is really, really important. Also, getting involved in clinical cases. So it goes hand by hand with showing interest. If you see a patient and the doctor sees that you are interested and that you want to suggest the treatment, or maybe you say, okay, I read this in an article, or I read this in a book, or our professor said this during one class, then you can, everything here is mistake and learning with your mistakes. So maybe you can say something to this doctor and he will teach you something that you didn't know before. So getting involved is really important. Also building a network, people that you see every day in the hospital, and again, balance study, personal life. I would say that these first years, staying focused and curious are key elements. So you should prioritize your own mental health, but discipline is really important in these few years because this will be the basis later in the next years. Also, resilience is something I would like to emphasize because it's really life-changing your routine before med school and then during med school. So you have to kind of be resilient and overcome these challenges. Just trust yourself, you can do it, and always keep in mind what motivated you to start here. So when I was in third semester, one of my professors told us to write in a little paper just a little message reminding ourselves why we chose to study medicine, and whenever we thought we were not doing well or we didn't want it anymore, we could get this paper out and read it. So I think keeping in mind what motivated you and having well established your goals will be really important in these first years. Now, the next stage in my medical studies was the internship. So my internship was divided. I did it in a private hospital and 2 public hospitals. So how it works in Mexico, I think this is different than in the US, but for private hospitals, patients pay completely for their medical attention, and public hospitals normally are hospitals that the government just pays for the doctors and for the medication and everything. So it's really different one from another, and the type of patient that we see in private and in public are really different. So I think this was important also to broaden my perspective, not only in different health systems, but also in like, I lived in a bubble, and when I started going to public hospitals, my bubble was like, I couldn't, it's not something that you're used to see. So it can be hard to know this different reality to other people. So during my internship, I would say stay true to your values. You will have a lot of contact with patients. So it's really important to always keep in mind your values, empathy, listen to the patients, don't get overwhelmed. Just try to do your best effort. If you don't know something, you can ask anyone. You are not alone. So I think being real and keeping in mind what you have learned in previous years, and again, your goals will keep you through these tough times. And I will first say a little bit of how my internship was, my day-to-day. So I would wake up and get to the hospital. Also, it's really early, about 7 a.m. And I would be, every month was different. This was a whole year, so every month was different. Maybe I was in the surgery department, and then if you were in the surgery department, then you would go see a patient that was going to get surgery that day. You do all the questions to build their clinical history. So you kind of get all this information from them, and then verify the indications that the doctor would write for the hospital and for the nurses and the doctors that were here. So we would see the patient, analyze their whatever disease they had, or whatever the procedure was going to be, and we would talk about it with other doctors and interns that were in the hospital. So at the end of the day, when they finished their surgery, we would go back to the room of the patient, evaluate them, and just keep an eye on them. If they were feeling bad, we would be the first person to go to the room, evaluate them, and then we would talk to the attending or other doctors in the hospital, and we would talk, okay, my patient had this surgery and I think he's having nausea because of this medication that they gave him. So I'm going to suggest, what if we give him this other medication, or what if we stop food for today and we continue later? So it will be a lot of contact with patients and doctors, and this is a really great time to practice all you can. Don't be scared to ask the patients all their medical history, and try to analyze on your own what would be like making your own conclusions on the patients, and talking with other doctors. Also, it's this way of getting involved with clinical cases. And I would say that studying after each case would be really important to remember this in the future. So try everything. You never know if you will have this opportunity again. Maybe you see a patient with a disease you will never see again. Maybe it's something genetic. Maybe it's something that it's not common. So try to evaluate the patient, keep your eyes open, and talk about it with other doctors to kind of exchange this knowledge. This will be really helpful to remember and to study. And I would say expect a change in your perspective of life, because this is a year where you are in the hospital all the time, or at least that was in my education. We would be one day from 7 to 3 p.m., then the next day from 7 to 3 p.m., and then we would be from 7 to 3 p.m. of the next day. So those are really long shifts in the hospital, and having this much contact with patients will definitely change the way you see life. You will see good things and you will see sad things. In my internship, I had my first contact with death, so you see people die, and it is hard. It is really hard, but it will be inevitable. I remember the first time I was in the emergency department and I saw a patient with cancer. She was about 50 years old and she was brought without pulse. She was unconscious and we immediately started CPR. And this was really hard for me because you learn the theory, you may use mannequins, but when you see it in real life, it will change the way you live and you see life. So it is important to be strong and to, again, keep in mind your values. So this would be like the sad part, but also there are many beautiful things during internship that I loved. I was 1 month in the neonatal department, so we would be with pediatricians receiving the newborns. So that was the beautiful thing about medicine, and it's the duality. You see life and you see death, and you see the baby and receive it and introduce it to their mother, and it's very beautiful to see that kind of love. So you just have to keep in mind that you will see both things and try to make the most out of it. So you can develop this type of empathy and like trying to fall in love again with your passion of medicine. And I would say here that you can impact other people's lives and you have to keep that in mind because the patients are vulnerable. They have a disease, they're scared, they are going to be in a surgery. So keep in mind that you are someone that has impact on their lives, and whatever you say will make a difference in their day. So always try to live with empathy and patience and love, and always try to be happy with them. Answer their questions if you don't know how to answer their question, because sometimes patients ask things that you don't know the answer, or maybe you think you should not be like, someone else should give them that kind of answer. So just keep your mind open, talk with doctors who have more experience, and keep in mind that you are someone that will make a difference in their day. Talking about more academic purposes, during this year, gather references. So if you were close to a doctor or you saw this doctor a lot of times and helped him with patients, then try to keep this doctor as a mentor again, or someone that could in the future help you with references, because at least in my experience, there are some hospitals that will later ask for references from your medical studies, and someone that was close to you and that saw how you work will make a difference on how you portray to other people and how they talk about you will help you to make a good first impression and open doors of opportunities. So try to gather references. And again, ask all the questions that you can. You're still a student, so it's really important that you keep curious and studying and asking questions to everyone. Balance study and personal life. I would say that during internship, keeping this balance was more difficult because of the long shifts we had, but just try to prioritize your free time and maybe find a new hobby or something, because it will be really important. And then I would say for this year, in Mexico, we have something that's called social service, and it's a mandatory year where we are supposed to kind of give back to our country to help the society using our knowledge. So we can choose to do it rather in a community, in a rural community, or doing research or helping your university. I chose to do it in research because I've always liked the process of research, and I think it's really helpful for kind of learning new things and making better the medical attention. So I chose to do it in research. I did it in the National Institute of Neurology and Neurosurgery, as I said, research about endovascular neurology because I like neuroscience. So I would say, I know you don't have this in the US, but if you have time later in your career, I would say focus on your interest and try to be proactive, like finding new things to do or creating spaces for your own development, and keep studying, think about extracurricular things you can do, getting you involved in, maybe you want to teach biology to high school students, or I don't know, anatomy to first semester students. So just try to make it diverse and always shaping with whatever are your interests. Maybe do some volunteer work or participating in conferences and congresses, contests, finding scholarships. If you find any association of doctors that you would like to join later in life, you can subscribe to their newsletters, or maybe finding universities and different programs, and just have fun, because this is a really very rich career where you can do whatever you want to do, you can find it in medicine. So just try to look for different things and make it flexible to shape your own path, and embrace the journey. It will be difficult sometimes, it will be incredible other times, and I would say those are the most important things that I would have liked someone to tell me before I studied medicine. And these are just some options that, so you don't have the idea that medicine is only studying and then giving consultation, or studying and just being a surgeon and operating room and everything. So there are many things you can do after you study medicine. You can build your own business, you can have your own clinic, you can develop, I don't know, any medical device and sell it. So that would be one. You could be more about global health, so epidemiology, or you can work in an NGO, or just focusing on making better public policies in your country or in other countries. This is something really important that we need in the world. So that would be something interesting to do. You can do research and do clinical trials. These are really interesting, and I think are important for the future of medicine and the world. So physician researcher would be an option. Also, as an ethicist, you can be a bioethicist and work in hospitals to kind of decide in medical dilemmas, and it's a really interesting different path that you can do. Or surgery, plastic surgery, any type, these different types of specialties. Or you can develop your artistic side and do your own drawings for anatomy books. Or I met this doctor, this neurologist, who took pictures of the brain and tissues. So he sold these pieces of art, and it was also something beside giving consultation. Clinical specialties, like endocrinology, neurology, and other types of things that you already know. And maybe medical journalist could be about making content for students, make terms simpler so they can study. And this is also important for the future medical doctors. So it's really beautiful to see doctors that want to contribute with education. And just remember that your journey is a canvas, and you can paint it with empathy and your knowledge, and you will be shaping it along the way. And that a career in medicine is a lifelong journey, and you will keep studying your whole life, but at the end is your passion. So you must make sure that you enjoy it and just embrace the challenge. Keep in mind your motivation and really enjoy, because medicine it's a really beautiful career, and it's rewarding, and there's nothing better than talking to a patient after you evaluate them or give them their treatment, and they express in a really beautiful way, which makes you feel happy that you chose this. So just enjoy the career, and good luck. This is my email. If you have any questions, you can send me, and I will try to answer the whenever I can, which could take some days, but I try to be there. So that would be all.
Thank you so much. Sorry.
Thank you.
Thank you so much, Anna.
So if
So-
anyone has any
welcome.
questions, you could just type into the chat or unmute yourself. Feel free to do so. But I have a question. So I am a pre-dental student, but I know that dental school and medical schools, the prerequisites align a lot, like taking general chemistry, your biology. So how did you go about doing the prerequisites?
Well, I don't know if it's the same in Mexico than the US. We do have before university, we have a 5-week introduction course. So everyone goes into university knowing kind of or having the same basic concepts. And then the first 2 or 3 semesters, we share these like anatomy and biochemistry. So in my university, medical students and sometimes like bioengineering, dentistry, and physical rehabilitation. We used to share classrooms, and it was like kind of helping each other, but it wasn't, I don't know if you mean like how was it to work with people from different careers, but it was kind of working as a team. If someone doesn't understand anything, we help each other, and again, like building friendships. So it's important to make these connections with people from different career paths. But yeah, those were my prerequisites before medical school.
Okay, thank you.
I have a question. You mentioned earlier that you have to create like a discipline in order to get through med school or just any of your studies. How long did it take it to, I guess, adapt or make that discipline? Because I know for me, I've been going to school for like a few years now. I still find it hard to like create a discipline where I know I'm supposed to study, but I'm just like I get so much distractions where I study like at the last minute. So I don't know, maybe you have any tips or like anything that helped you along the way to create a discipline for
Yeah,
studying or any other.
I would say that whenever you have a question or you don't understand, you can write it down and immediately make it fun for you. So try to look for a video in YouTube, or this Osmosis platform is really, I don't know if you know it or if you've heard about it,
Yeah,
but
I got it. Yeah.
it's fun to see. It has drawings, so it's like visually appealing. And I would say try not to make it like a core, like don't feel you have the obligation to study this. Just download apps so it's easy. If you're in your phone, you just go in your app and just answer your own question, or kind of express study but in the moment when you have this question. And then um, maybe you can do each week a recap on what you saw on the week. And it's more of a habit, but try to build small habits, and eventually it will be something you can do like easily, and it won't be hard.
I see, I see. Thank you. So you're like kind of like make not like make a game out of it, but just kind of like make it fun to learn, I guess. I don't know.
Yes,
Yeah.
definitely.
Okay. Thank you.
All right, so doesn't seem like we have any more questions. Anna, thank you so much for coming today. I'm sure your presentation was very insightful to some of our members. And so members, if you're gonna come to our final meeting, please, there's a Google form in the chat you could fill out for a Q&A. We'll be having a dietitian, I believe it's Dr. Dinsdale. Great, okay. Thank you for coming, guys. You can log off if you've done the attendance form. Bye,
Thank you for
everyone.
having me. Good luck. If you
Thank you,
have
Anna.
any questions, you can write to me. I will be happy. It's always refreshing to listen to people who have this interest. So really, if you have any question, you can write to me.
Okay, thank you.
Thank you.